Oh, I think Marlon might have already started it. Awesome. All righty. So just a quick overview of our agenda. We have some opening remarks from our local health authority and Austin Public Health Medical Director, Dr. 𝗏𝘁𝗄. We'll then move on to an overview of who we are at Austin Public Health, your public health emergency preparedness team, a vision statement for our MRC, a little bit about what an MRC is, what you can expect from the unit, what opportunities are available to you as a volunteer in emergency and non-emergencies, and then the logistics of becoming a member, so the step-by-step process, what that looks like. And then we'll cover briefly what to expect from orientations and meetings, and we'll close out with a question and answer session. And like I said, if you have questions throughout the presentation, feel free to drop those in the chat and we'll just answer them all at the end. And with that being said, I'm going to turn it over to Dr. 𝗏𝘁𝗄. She is our medical director here at Austin Public Health, and she is also the local health authority for the Austin-Travis County area. Thank you, Dr. 𝗏𝘁𝗄.
Thanks. Thanks to everybody for joining us tonight. We're very excited. We've been working on this for almost a year now, revitalizing and reviving and resuming our medical reserve corps. The team's really worked hard at putting this presentation together and putting the program together. So hats off to the team. Thank you very much. As everybody on the call knows, it's so important to have volunteers who are willing to step up in times of emergency. And many of you on this call have done that in the past, and there may be some new people here that are joining this group. And we're really excited that you're here. Your contribution to our response efforts is really, really welcomed, and we're really glad that you've come to do this. The team has put together a series of presentations and trainings that will help us all prepare to seamlessly, hopefully, get out there and respond to any of those emergencies that we may have in our future. We've done quite a bit of work, as everybody knows, to respond to COVID and have lots of lessons learned. So those have all been put into the mix as we prepare for this MRC group, and we're happy once again that you're here, and thank you so much.
Thank you, Dr. 𝗏𝘁𝗄. All right, folks, so we're going to jump right into who we are here at Austin Public Health. The Austin-Travis County Medical Reserve Corps is going to be housed under the Austin Public Health Emergency Preparedness Program, otherwise known as PHEP, which is Public Health Emergency Preparedness. We are a team comprised of emergency planners, disaster epidemiologists, we have a research analyst, as well as a graphic designer. And what we do on a daily basis is prepare for and respond to any and all emergencies that can impact public health. And almost all emergencies do impact public health in some way, shape, or form. Just an example of some of the response operations that we've had in the last year or so. We responded to Winter Storm Mara last year. And for us, what that looked like was assisting with shelter operations for the unhoused and for the general public. We also helped with recovery efforts in the form of a multi-agency resource center that helped to connect the impacted community members with the resources and hot food while they were recovering from that impact of that storm. We also activated this year for West Nile virus in our community and responded to that. Additionally, we've done a lot of work with mpox within our community and also COVID-19. So I'm sure many of you will remember Austin Public Health had those giant, massive vaccine clinics out at 𝗙𝘁𝗃 and the Burger Center that just take so much personnel and planning and resources to put on a huge vaccination clinic of that size to get everyone in the community vaccinated. Additionally, we've responded to Zika, Ebola, and measles in recent history. And then outside of emergency response, we do a lot of planning and day-to-day preparation for those emergency incidents and events. So we write plans to outline how we would respond to certain incidents. We also then exercise and train for those responses. So we design and conduct exercises internally and with the community at large. And then we also focus a lot of effort on building out our partnerships with the community so that when we do respond to an incident or an event, we are incorporating the perspectives of the whole community, and particularly the most vulnerable within that community, to make sure that they're also taken care of throughout an incident response. So our Austin Travis County Medical Reserve Corps vision, so vision of ATCMRC is to strengthen public health, reduce vulnerability, and build resiliency of the community through the engagement of community volunteers like yourselves who dedicate their time and expertise to support the already existing infrastructures of the Austin Travis County and surrounding area. So for us, that means we really want to engage and get a group of dedicated individuals who are willing to participate in emergency responses, but also who are willing and able to participate in day-to-day routine or programmatic events such as vaccination clinics or outreach events, preparedness fairs, and the like, to help our community build resiliency and be more prepared. So what is an MRC? So Medical Reserve Corps is a national network of volunteers that is organized at the local level. So for us at the Austin Travis County MRC, we are organized through Austin Public Health, which is a local health department here in Austin and Travis County. MRC as a whole launched in 2002 as a response to the events of 9/11, and it was formally established in 2006 when Congress passed the Pandemic and All Hazards Preparedness Act, which aimed to provide for an adequate supply of volunteers in the case of a local, federal, state, or tribal emergency. Nationwide, there are 750 units and there are over 300,000 volunteers. So it's a huge network of trained people who are ready to go in the case of an emergency. And then in our area specifically, we have a few other units around us. We've got the UTMRC out of the University of Texas, and then Williamson County MRC. And both of those units have been really instrumental in helping us get our unit launched, helping us to understand what best practices are and what our meetings should look like. So we hope to really continue those collaborations in the future when we're planning for events or when we're responding to an emergency, so that we can really incorporate the whole community and utilize our resources that are available to us to respond. I'm gonna play a short clip for you folks.
While Eleanor is getting that clip started, if everybody could put their name and affiliation in the chat, that would be great. And then after the presentation, we can go around and introduce ourselves and do some Q&A.
Thank you, Dr. Walks. All right, I'm going to mute myself and then hit play.
There are more than 300,000 trained and ready volunteers of the Medical Reserve Corps in nearly 800 communities across the U.S. and its territories. Some are nurses, doctors, or public health professionals, and those without a medical background also play critical roles. Some are students, some are in various sectors of the workforce, and some are retirees. And all of them are trained and equipped to serve their communities with first aid, community education, and responding to emergencies. A volunteer may have greeted you at a COVID-19 vaccination clinic, given you a flu shot, provided shelter during a hot day, or were even there to help in disaster situations. In 2022, the network's 20th year of service, Medical Reserve Corps volunteers dedicated over 1 million hours to their communities at an economic value of over $35 million. MRC volunteers are your neighbors, and tomorrow, one of them could be you.
So as you saw in the video and I explained before, MRC is, sorry, let me make this full screen. MRC is a national network of volunteers that is comprised not only of medical professionals, but also students, general community members, anyone that has an interest in emergency response and preparedness and a willingness to serve their community is welcome to be a part of our MRC, as long as they are over the age of 18. Throw that in there. And with that, I'm going to turn it over to our PhET program manager, Anna, and she'll go over a few of the volunteer opportunities that'll be available to you all.
Thanks, Eleanor. Good evening, everyone. I'm Ana Urueta. I'm with Austin Public Health Emergency Preparedness Program. I'm so excited to have you all here today and to have the opportunity to share with you the work that we've been doing to ramp up and start a medical reserve corps. We have definitely felt the need for being able to bring in volunteers whenever we have disaster response. Fortunately, we have had some capacity to do so through the Travis County Medical Society in the past, especially through COVID. But we recognized that there was really a need for us to have a medical reserve corps. So I'm so excited to get this started. And I just wanted to contribute some to the presentation and provide some overview of the type of opportunities that you might be exposed to while joining the MRC. So you might think, what will we be supporting whenever there are no emergencies? Well, there's both emergency and non-emergency opportunities. And Eleanor mentioned some of the opportunities with points of dispensing. Maybe some of you have already worked at one of our points of dispensing. Some examples I can think of are our mass vaccination clinics that we stood up during COVID, like at the 𝗙liche site. We're at the Burger Center where we set up a drive-through and we vaccinated thousands of individuals when COVID was happening. But we've also set points of dispensing up whenever we've had smaller responses. So the last ones that we set up were during mpox, the mpox outbreak, and we started receiving vaccination from the federal government and from the state. We stood up a small vaccination clinic at one of the schools, and that would have been a great opportunity for us to bring in our volunteers. So you might find yourself definitely supporting a point of dispensing. And within a point of dispensing, we have both medical and non-medical positions. So if you're in a medical position, you might find yourself vaccinating individuals or providing consultation, a medical consultation. And if you're in a non-medical role, you might find yourself supporting with logistics or overseeing the operations of the event, or even something as simple but as vital as helping with traffic control. Next slide. We have been doing a lot of work with community assistance support. In public health, this is part of our day-to-day. We are always out helping the community and identifying ways that we can help those that need it the most. But especially during emergencies and through all of the lessons that we have learned from the last disasters, we have been doing a lot of work with standing up resilience hubs and making sure that there are strike teams ready to deploy whenever we have, or right immediately after a storm, to help with recovery efforts. We have stood up multi-agency resource centers to support, provide resources to individuals that need when they still don't have power and they need food because all of the food in their fridge has gone bad. So there's a lot of opportunities just throughout community assistance support, and you being a volunteer with the MRC would allow you to really have that connection with the community. And if you wanted to focus in a specific neighborhood, then you'd have the ability to do so. But we are expanding a lot in our community assistance support, and this is an area that we're very excited to have some support in as well. Next slide. You might be aware that shelter support is needed. As an example, tonight, it's so cold, we are going to activate our cold weather shelters. So the city of Austin activates cold weather shelters anytime we meet certain thresholds. So if it's 32 degrees or below, or 35 degrees and precipitation or wind chill of 32 or below, just anytime that we meet a certain threshold, we'll have cold weather shelters. And we do have contracts in place to help with these things, but with a growing population in Austin and added outreach to let the population know about these resources, we have more people seeking these services. And with that, we need more support. And so there's shelter support is definitely another area that you might be requested to support in. And finally, with case investigation and disease surveillance, this area is an area that we would request support once our capacity has been surpassed. And so we have a team of epidemiologists, and we have our Austin Public Health team that would support case investigations and disease surveillance. But in a case of a disaster, we might encounter a situation where we're just completely tapped out, especially if the disaster has gone on for a long time. And so there are definitely opportunities for both medical and non-medical volunteers to support this endeavor. And as I mentioned before, there are non-emergency opportunities. So if there are no emergencies happening, which is what we hope to be in this realm at all times, there are opportunities to continue to be active. And so we have lots of vaccination clinics. Some examples are our yearly Boo the Flu, where we put on a flu clinic and we vaccinate our community with the flu. We have back to school immunizations opportunities. And this is just another way that you can come in and support the community. We do lots of outreach events and health fairs. Being in public health emergency preparedness, we understand the importance of preparing people prior to the emergency occurring. And so we attend a monthly event at different neighborhoods, libraries throughout the year, where we share information on how to create a preparedness kit and how to make sure that you have the Warren Central Texas emergency phone number registered in your phone, and a lot of engagement that goes on with the community to really build up that preparedness and that resilience. And as an MRC volunteer, if this is your interest, you would have an opportunity to join us in these endeavors and come out to the libraries and talk with the community and think of creative ways of improving that preparedness and that resilience as well. Because we're always looking for out-of-the-box ideas and better ways of improving that as well. And finally, there are a lot of trainings and exercises, especially during non-emergency times. We want to make sure that we're training everybody so everybody feels comfortable and prepared to respond to the emergencies. And whenever an event or an incident doesn't happen, then we have exercises to test those plans and go back and make sure that we're updating our plans adequately. And so not only do you have opportunities to come to take those trainings and become familiarized with the processes, but if you have the time and the desire to become a trainer yourself, there will be opportunities for that as well. And I'm sure that many of you also have lots of expertise that you can bring to the table that we don't have within our team, or that can help expand our current capacity. Say maybe you're certified to teach CPR, or you already know a lot of your FEMA trainings, then you can support with providing those trainings as well. Thank you.
Thank you, Anna. Appreciate that. All right. So outside, Anna talked a lot about the traditional volunteer opportunities, but we also want to create one of our big goals when we were thinking about what we wanted this unit to look like is that we want to really engage folks, and through discussions with UT and Williamson County, we know that for an MRC to really be successful, that this has to be a space for you as volunteers to bring your passions and your expertise and the things you care about to our unit and allow us to kind of expand or build upon that. So we'll have tons of professional opportunities, like Anna said, trainings and exercises. We will offer different courses that you can take to learn more about emergency preparedness and emergency response. But additionally, we really want people to bring the things that they're passionate about and the things that they would like to contribute, because as a public health entity, we are a bit limited in what we can do and the resources that we have. So we hope that this volunteer unit can really capitalize on that creative aspect of responding to our community and building on what people are passionate about. And I think, in conversation with Williamson County, Tim St. Peter, who's actually on this call, gave us a great example of what that kind of looks like in practice. And they had a volunteer that was really passionate about the aging community, and she started a pilot program called the Wise Owls that connected folks in long-term care facilities or nursing homes with volunteers who wrote them letters or called them or gave them a video chat. To help them feel less isolated throughout the pandemic, when people couldn't go visit them or were pretty isolated in terms of the aging population. And now that initiative has become its own nonprofit. And so we really hope to engage with our volunteers in a similar manner, allowing you to explore the topics and the ideas that you have that you're passionate about, and let's build those out. So steps to becoming a member. We really wanted to keep this as streamlined and as simple as possible for everyone. So initially, you'll complete an online interest form that is on our website, and Marlon is going to drop the link in the chat for you all. So you complete that interest form. It'll go through just a basic understanding of who you are, your experiences in volunteering and professionally, as well as any trainings you may have already taken. And then if you are a medical professional or a licensed or credentialed individual, it will ask what your license is. After you've completed that online interest form, you will attend a monthly orientation. Those are going to be held virtually, and that'll provide a space for you to learn more about us and who we are as a unit, and then what we expect from you as a volunteer. So those will be held online through Teams. And like I said, you will only have to complete one of those, so you can choose which one you attend. You'll be able to select them on the interest form when you complete it. After you've attended a monthly orientation, you'll complete some basic ICS training. So it's an incident command training to help familiarize you with what an incident response looks like, what that structure and organization is, so that when we respond, you are already familiar with what that process looks like. Those are done online and can be done at your own pace, and they're completely free to the public, but we'll provide more information about those during your orientation. Additionally, we'll perform a background check, and these are mandatory for any and all volunteers through APH just because of the sensitivity of the work that we do and the populations that we work with. And these are going to be completed through the Texas Disaster Volunteer Agency. After you've done those steps, you'll attend a monthly meeting. We plan to host these in person, and we haven't selected a location. I'll give a little more detail about what to expect from those. But we hope that these are a space for us to learn more about each other, to learn more about preparedness in general, and also create an atmosphere that really is conducive to building community resilience. And then after you've attended that monthly meeting and passed your background check, we'll take your photo and you'll be issued a badge and a t-shirt, and you will now be considered an active member of the MRC. And then just a note, to keep your active status, we would ask that you would commit to attending one monthly meeting or one event or one response throughout the year. We're trying to keep the commitment as low as possible and allowing our volunteers to really choose what their interests are and what they want to participate in. So our monthly orientations, they will be held virtually on Teams, so the same platform we're using for this meeting. The topics that we'll cover, like I said, are an overview of our MRC unit, what we expect from volunteers in terms of commitment, behavior and conduct, and then what you can expect from us. We'll also go over those training requirements. Like I said, the ICS trainings, we'll ask that you take 100 and 200, and those are online, but we'll provide all of that information during your orientation. And then we'll also go through what volunteer opportunities are available in more depth. So we'll get you familiar with the different types of projects that we already have in mind, and hopefully gauge more about what your interests are and what projects you would like to bring to our unit. And we already have those scheduled, the first 3. So those will be starting in February. Our first one will be Tuesday, February 6th, and then again on March 5th and April 2nd. And like I said, you only have to attend one orientation. It really is meant to just be an intro to what MRC is and what to expect. And you can register for those directly through the interest form that you'll submit online. Monthly meetings. So we want to hold our meetings in person. Our location is TBD. We're hoping to find a more central location. We're located in South Austin, but we will send out that information as we have it. Our meetings will be a mix of trainings and guest speakers. For instance, our training topics would be personal preparedness, building a kit, so making sure that you are prepared and ready to respond if and when an emergency happens. Neighborhood preparedness, so helping you to understand how to prepare your community and those around you. We'll go into more depth about ICS and what incident command structure looks like and how that looks in a public health response. And then we'll also offer some more in-depth training, CPR, basic life support, some pod training, equity training, so that you're familiar with the community as a whole and how we can be more equitable when we are working through an emergency to make sure that the most vulnerable in our community are taken care of and have their needs met. In addition, we hope to have some guest speakers come in and provide more information to you about the different collaborations within emergency response. So we hope to get the National Weather Service in to talk about how we collaborate and how the information flows between us and them, especially when we're in a severe weather incident. We'll talk about some critical incident stress management, and then we'll also have our disaster epidemiologists talk about what they do on a daily basis and then how they respond in a public health emergency. So that will take us to questions. I'm going to go ahead and answer any questions that are in the chat. Marlon, if you don't mind sharing those with me. And then if you just raise your hands, we'll call on people as soon as those questions have been answered.
Hello, everyone. We do have one question in the chat from some of our folks who had volunteered previously. If I did the volunteer, or if I did the volunteer application form and background check during the COVID clinics, do I need to do those steps again?
I do believe, Anna, correct me if I'm wrong, I believe we will have to do them again since this is a fresh program and we'll want to make sure that all of our I's are dotted and our T's are crossed. So we will have to do another background check that is completely free to you. We will pay for it. We'll just have to get that information from you. And then we do ask that you submit the interest form because that is how we are tracking our enrollment. And it is also how you'll sign up for those orientations.
Those are our questions from the chat. So we should be good to go to live questions.
Awesome. Anybody else have questions?
Yeah, I think that right now could be a good sorry, go ahead. I was gonna say could be a good opportunity for us to introduce ourselves and go through and see who's in the room, but I do see there's a hand up.
Sorry,
yeah, actually, go ahead.
So you just said that the monthly meetings, the obligation is just once per year, is that correct? Okay.
Yes, we do ask that our volunteers attend one. You do have to attend at least one monthly meeting to be considered an active volunteer. And then once you're active, we just ask that you participate in at least one meeting, one event, or a response throughout the year.
Thank you.
Yes, thank you. Do we want to go ahead and do introductions real quick? I'm so sorry, I forgot about that. I'll go ahead and start off again. My name's Eleanor. I'm the MRC unit coordinator. So you'll be hearing a lot from me. Then I'll kick it over to Anna, if that's okay.
Oh, sure. Hello again. I'm Anna 𝗷𝘗𝘗 with Austin Public Health Emergency Preparedness Program. And I will kick it over to Marlon, and then we can do all of FEP before we move on.
Hello. So also on the Public Health Emergency Preparedness team, I am Marlon Haygood, an Emergency Plans Officer. Pass it to Cody.
Evening, everyone. Cody Hyde. I am one of the disaster epidemiologists for the Public Health Emergency Preparedness team. I will pass it to Kathy.
We'll circle back to her. She's having some connectivity issues with her headphones. So Michelle, will you go ahead and introduce yourself?
Hello, everybody. My name is Michelle, and I am the research analyst for the emergency preparedness team at Austin Public Health. I'm excited to get to know you all.
All right. Can we have the folks from the ATCMRC introduce themselves next while Kathy gets connected?
Hi, can you hear me? This is Li Chen.
We can hear you.
Perfect. I am one of the leaders for the ATCMRC team, and I see Steve Yenda on the call as well. I'm happy to see his name on the attendee list. I've been with ATCMRC for several years, and also connected with this great group here and team also from, I think, the 𝗙𝘁𝗆 So I'm happy to be here, and I'm looking forward to see the future collaboration. I see that we have a lot of the benefit with the ATCMRC, and I think we can complement each other at kind of what we did with the 𝗙𝘁𝗆. So I look forward to collaboration, and thank you for inviting me.
Thank you for being here. there anyone else from UTMRC on?
Steve, are you still on? Do you want to introduce yourself?
All right, we'll move on to, I believe Tim, the MRC director or unit director from Williamson County, is also on. Tim, would you introduce yourself, please?
Hi, can you hear me?
Yes.
Yeah, okay,
Yes.
good. Sorry, I have a new laptop. Yeah, I'm Tim St. Peter, and we're located at the Health District in Round Rock, so we're not too far away. Been have been there for 3 years, maybe a little bit longer, and really enjoy MRC. Enjoy my volunteers very much. And I have enjoyed working with the group from Austin Public Health that are on in the meeting today on this call. And if you're a new person who's interested in volunteering in Austin, I always reiterate some really important things. This is a great group of people. I've been working with them, and they have been very, very passionate about getting this started and making a good team. So really glad to be partnering with this group. But also, we all live in Austin, which is home of Texas Emergency Management, and Austin Emergency Management is a very respectable group. So this is a great place for an MRC team of this magnitude to get started, and I really do appreciate you allowing me to be involved.
Thank you. We really appreciate your expertise in all things MRC. It's been very helpful in getting us going, and having you to lean on has been great. William, would you like to introduce yourself since you're also with us?
Hi, everyone. My name is William Malm. I'm a public information officer with Austin Public Health. I'm part of the FEP team, but I work on almost everything they do. So happy to meet you all.
Thank you. I'm going to go ahead and introduce Kathy. I know she threw her information in the chat. Her headphones aren't working for whatever reason. Sorry, I think I have an echo.
Hello, can you hear me?
Oh, there you are.
I don't know what I did differently. Apologies, everyone. Hello, I'm Kathy Bettis, and I am a planner with the Public Health Emergency Preparedness Team. Happy to meet you all.
Thank you. I'm just going to go ahead and go down the list to call on people to introduce themselves. Apologies if I mispronounce your name. Feel free to correct me. So I'm going to just go in order of the list on my screen. Anu M. All right, Dr. Scaff. Is that how you pronounce your name? Scaff?
Yes, can you hear me?
Yes, sir.
Yeah, just got the email, thought I'd listen in and see what's going on.
Awesome, welcome. Thank you for being here. Next will be Cindy Lynn.
Hi, I'm Cindy Lynn. I'm a neonatologist looking for some volunteer opportunities. I did some COVID vaccines. That was a lot of fun.
Awesome. Thanks for joining us. Oh, was I muted whenever I said that? Sorry about that. Next is Dr. Falvo.
Hi, can you guys hear me? I'm
Yes.
Heather Falvo. I'm an internist, and I'm a member of the Texas Physicians for Social Responsibility, and we focus largely on climate issues. So when I saw this come across, I thought this would be interesting, and I also did the COVID clinics, which I also enjoyed.
Thank you. Thank you for donating your time during COVID as well. Next, we'll have Jasmine. All right, we'll move on to Jim Michon. Nishant? All right, next we can move on to Steve, or actually, sorry, it's Ron DeWitt.
I'm Ron DeWitt. I'm a family practitioner until then and still have my license. So I guess that means I can still play.
Thank you for being here, Dr. DeWitt. Next, we'll have Steve Janda.
But I think there was a note in the chat where he introduced himself. There's some mic issues, but thank you for coming, Steve.
Awesome. Thank you, Marlon. And thank you, Steve. And then it looks like we will have William Medrano. All right. There are a couple of people that have joined from their phones. If either of you would like to introduce yourself, feel free to just come off mute and give us a little introduction.
Hello, this is Rubina Kunawala. Can you hear me?
Yes, we can hear you.
Yes, I'm a family physician in Austin, Texas, and I enjoy volunteering. I have been part of the Travis County Public Health Committee and Dr. 𝗙𝗵𝘆. I've known her for an eternity, I think. But I enjoy volunteering because I learn a lot. I learn about people, I learn about the organizations, I learn what is out there in the community. I volunteered at the COVID clinic and vaccination clinic, and I learned so much. So I definitely am interested, especially in the Williamson County, the aged population. We have some project going on, and I would like some information on that project. Because I'm doing a similar project on intergenerational connections between seniors and high school, middle and high schoolers in the Manor ISD. So I definitely would appreciate some information about that. But thank you so much for inviting me to this meeting.
Yeah, thank you for being here. Tim is going to be the expert on all things Williamson County. So Tim, I believe she had wanted more information about your Wise Owl project that came out of your unit. If you don't mind just dropping your email in the chat so she can reach out to you directly.
I am on the phone, so I don't have access to the chat.
Oh, sorry about that.
Thank you.
Yeah, sorry to interrupt. All you have to do is when you get to a computer, just type in Wise Owl Initiative, and it'll take you straight to their website because she is her own nonprofit now. So that specific group is no longer tied to MRC. So you can just type in Wise Owl Initiative, and it'll pull it up for you.
Great, thank you so much.
Thank you both. I believe that's it for introductions. So if anyone else has any questions, we can answer those now. All right, well, hearing no questions, I just want to thank you all again. I'm going to put my contact information on the screen. Please feel free to reach out. Marlon, if you don't mind dropping the link to our webpage one more time in the chat, just so people have it fresh in their memory. Feel free to go on and submit that interest form and sign up for an orientation, or reach out to me or our unit if you have any questions. Our unit email is on the screen. Our phone number and webpage are also listed there. And then at the bottom of the screen is my work email as well. If you'd like to reach out to me personally, feel free. And just want to thank you all again. We're really, really excited to get this unit off the ground. We're excited to really build our community partnerships and to be able to serve our community and be more prepared for those future emergencies. Thank you.
Everyone, we'll see you next.
Thank
Thank you
everybody.
all. Hope to see you all at our first orientation, February 6th.
Ron, if you have a question, you can go ahead and unmute.
So where do we get the form that we're supposed to try to complete?
That's right.
It is online on our website. You'll just click the link to the website. There's a banner at the top. There's also a little spot that says join here, and just click that link and that'll take you right to the form. If you have any trouble accessing it, feel free to shoot me an email at either my work email or the ATCMRC@austintexas.gov, and we can work through whatever issues.
Okay, good deal. Thank you.
Thank you. I hope y'all of your evening and get home safely if you're still at work. Thank you.
Thanks.